Hello everyone. In this session we will take a look at another triangle which is located deep inside the root of the neck, and this is a bilateral triangle, and the name of this triangle is the Scalenovertebral triangle. That is, it is between the vertebral column and the scalenus anterior muscle. So this is roughly the scalenovertebral triangle on the left side. On the right side, see, the scalenus anterior muscle has been cut out to display the brachial plexus, but on the left side this is the scalenus anterior muscle and this is the scalenovertebral triangle. Now the boundaries of this triangle: medially you have the lower oblique part of the longus colli muscle over here, laterally you have here the scalenus anterior muscle, the apex is here, this is the transverse process of the sixth cervical vertebra, and the base is here, the first part of the subclavian artery. So between the longus colli, scalenus anterior, transverse process of the seventh cervical vertebra and the first part of the subclavian artery, this is the scalenovertebral triangle. Now the posterior wall of this triangle, as you can see, from the sixth cervical vertebra you come down, this is the transverse process of the seventh cervical vertebra, this is the first part of the floor. Below this you have the ventral ramus of the eighth cervical nerve passing outward over the neck of the first rib, and then this whitish structure, this is the neck of the first rib. As you can see, the rest of the first rib here, its bony part, its cartilaginous part, this is actually the back of the first rib, that is, this is the neck of the first rib, and below the neck of the first rib you have the dome of the pleura over here. So transverse process of the seventh cervical vertebra, neck of the first rib and the dome of the pleura, these are the structures which form the floor of the scalenovertebral triangle. Now as far as contents of the scalenovertebral triangle is concerned, the most important content that you can see here is this one, the first part of the vertebral artery. This is the important content of the scalenovertebral triangle, and you can see that the vertebral artery has taken root, it is an offshoot of the first part of the subclavian artery, and this is the transverse process of the seventh cervical vertebra. It has not gone through the foramen transversarium of this vertebra, but it is going through the foramen transversarium of the transverse process of the sixth cervical vertebra. So the first part of the vertebral artery and its accompanying veins, they are going right from the base of the scalenovertebral triangle to the apex of the scalenovertebral triangle. Apart from that, you have the cervical part of the sympathetic trunk, and here you can make out the middle cervical ganglion over here and the inferior cervical ganglion over here. Now what you can make out is that the middle cervical ganglion is roughly above the medial arch of the inferior thyroid artery. So this inferior thyroid artery, the arch of the inferior thyroid artery, is another content of the scalenovertebral triangle. Actually, in front of these structures you had the carotid sheath. These structures which have been cut out, the common carotid artery and the internal jugular vein, these were extending vertically up, and these would have covered the scalenovertebral triangle. So these structures that you can see, the vertebral artery and the inferior thyroid artery, they are actually behind the carotid sheath, behind this common carotid artery and internal jugular vein. And you can make out that the inferior thyroid artery has taken a medial loop in going to the thyroid gland, and just above this medial loop somewhere here is the middle cervical ganglion, and the inferior cervical ganglion is here on this side, and on this side if you had drawn it, it would be somewhere behind the vertebral artery over here. So this is roughly the position of the inferior cervical ganglion, and the middle and the inferior cervical ganglion are connected by a nerve loop which is called the ansa subclavia, which goes around the first part of the vertebral artery. So middle cervical ganglion over here, inferior cervical ganglions much below, and inferior cervical ganglion, although it's behind the vertebral artery, often it fuses with the first thoracic ganglion in front of the neck of the rib to form what is called the stellate ganglion. So inferior cervical ganglion and first thoracic ganglion, inferior cervical ganglion somewhere here, first thoracic ganglion somewhere here below. The two may fuse to form the cervicothoracic ganglion or the stellate ganglion. Not only that, you can make out that just as there was a medial loop of the inferior thyroid artery in the scalenovertebral triangle, there is a lateral loop of the thoracic duct on the left side, and similarly there would be a loop of the right lymphatic duct on the right side when it was going to the junction of the internal jugular and subclavian veins. So the entire lymphatics of the body empty into the venous system at this point, at the junction of the internal jugular and subclavian vein, as the thoracic duct on the left side and the right lymphatic duct on the right side. So the lateral loop of the thoracic duct and the medial loop of the inferior thyroid arteries, they are also contents of the scalenovertebral triangle. Not only that, in the lateral corner of the scalenovertebral triangle somewhere here, and going over the scalenus anterior muscle, you can make out the phrenic nerve. So this is the phrenic nerve, and this small one is the vagus nerve. Again you have the vagus nerve on this side and the phrenic nerve over here. So the phrenic nerve can also be considered to be as content of the scalenovertebral triangle for a little bit along its lateral margin. If we look at another picture, in this picture also you can see the scalenovertebral triangle, the apex here at the level of C6. Medially you have the longus colli, the oblique part. Laterally you have the scalenus anterior. Below you have the first part of the vertebral artery, and as a content you can see the first part of the subclavian artery rather, and as a content you can see the vertebral artery going from the base to the apex vertically up, and you can see the medial loop of the inferior thyroid artery rising from the thyrocervical trunk, inferior thyroid, transverse cervical and suprascapular arteries. Three arteries, or in another way you could say inferior thyroid, superficial cervical and suprascapular. You can see it better on this side. Inferior thyroid, transverse cervical, suprascapular, and again from the first part of the subclavian artery going down, internal thoracic artery, rising up, vertebral artery. So the medial loop of the inferior thyroid artery, and again here the lateral loop of the thoracic duct. You can see that as well. And just as you can see the transverse process of C6, there would be the transverse process of C7 over here, and this first strip arching back, the neck of the first strip would be somewhere here, and here is the dome of the pleura. So I think by these diagrams you will have formed some idea of the root of the neck and the scalenovertebral triangle. Now unless you actually dissect the root of the neck and see these complex structures for yourself, you cannot form a perfect idea. However, for the present this will have to do. Thank you.